Hi, Dr. Ray here. I'm making this video so that you can evaluate your brain and look for any pathology that might be present when you do your autopsy assignment. Here you can see two brains, one from a superior view and the other one from an inferior view. And at first glance, they might look very similar. But when you actually look at the amount of space between the gyri, the sulci seem to be more pronounced and wider on the side with the brain atrophy compared to the other side that just has a little bit of space, and you can see that the gyri are still rounded at the top, so they have a roundness to their appearance. These are definitely still round, but there's a much wider space. And so on the left here, that's an example of brain atrophy, kind of a global condition that you can find in your brain. And this is more normal looking. And then in this cross section, it's a little bit harder to appreciate edema, cerebral edema, unless it's very pronounced. But what you might notice when you're looking at these gyri, they're sticking up, is they're not rounded. So here you can see these are rounded at the top, and here these are flattened. And so if you're holding the brain and it feels like the outer surface is very flat, and there's very, very little, if any, space at all between the gyri, then that is an example of brain edema. And the brain swells in response to a drop of oxygen levels. And so a lot of the brains that we will look at will have edema. And so it's something that you'll be able to see probably in a tank in your lab, if not your own cadaverous brain. So the other thing you want to look for is you want to look for evidence of strokes. There are two kinds of strokes that you may find. One is a hemorrhagic stroke, where the blood actually leaks out of ruptured vessels and into the brain tissue or the surrounding tissue in different meningeal levels. And the other kind of stroke is an occlusive stroke, where blood is blocked from tissue. When you look at this brain on the left here, you can see that there's a different covering on this left side than the right side. And actually, I can't tell. This is probably more anterior, so I said that backwards. But the dura mater is still attached on this side of the brain, and you're looking at the arachnoid matter on this side here, which is the patient's left. And if the blood that you found, if you had a hemorrhagic stroke and you found the blood above this layer, it would be between the bone and the dura. And so that would be an epidural hematoma. And so that's one kind of hemorrhagic stroke. And then the other that you might see a little bit more often, we see in lab, you might see a subarachnoid hemorrhage might actually be under this arachnoid tissue. So between the actual brain tissue and the arachnoid mater, so in that subarachnoid space. And then you can see in this cross section here of the brain. So this is a horizontal section that's anterior. Here we have posterior. You can see that deep inside the brain, you see all these little blood vessels that actually are pretty good size. Here we have the basal nuclei, and this is a location where larger blood vessels really abruptly change into small blood vessels in the brain without a very good sort of gradient for pressure. And so if you do have a patient has a really, really high spike in blood pressure, what can happen is that they can rupture the blood vessels in this area. And so these basal nuclei here can have a lot of blood deep inside the brain. You may not see that from the outside, but just being aware that sometimes you can have hemorrhagic strokes that you can't see from the outside because of the reason that it's within the brain tissue itself. And then an occlusive stroke is a little bit harder to see sometimes grossly. And really depends on whether the occlusive stroke is acute, so it just happened before death, or whether or not it happened a long time ago. Whether or not you'll see different changes in tissue. The tissue will swell if it's blocked from blood, so you'll have edema in one side of the brain or not on the other. And then what you might see is you can see blood vessels in underneath this arachnoid model here in this brain, and one side might look pink and normal, kind of like this side, and the other side of the brain might have areas that are completely devoid of blood and will be clear white, and that might be an indication that the individual had an occlusive stroke. So look for these signs when you evaluate the brain. And then we have some herniation syndromes that you may be able to see within your brain. And this is very important because a lot of people actually have brain changes at depth as oxygen levels drop, the brain swells. And it can be that the herniation of the brain actually causes the individual's death. And so it's something that you might want to look at when you're doing this autopsy project. And so a central herniation is going to be a herniation that is a downward force. So here you can see the cerebrum is kind of shut into this bony capsule. And anything that causes an increase of pressure, whether it's a tumor, whether it's bleeding, whether it's edema, it will push the cerebrum downwards, towards the very tough tissue called the tentorium cerebelli that exists. And you'll be seeing that as we cut out the brain, that it's a very, very tough tissue and it's not very forgiving. And so if the brain gets pushed downward, then this part of the cerebrum will actually get kind of cut off and pushed through the tentorium cerebelli, and you'll see that grossly on the brain as you look at the inferior aspect, because it will kind of damage that part of the brain. So here I'm going to show you what that looks like here. The central herniation and uncal herniation. So there's the uncus, and it has been kind of squeezed through, and then the swelling caused it to kind of look like it's been pinched off of the brain. So this is the abnormal side with the central and uncal herniation from this temporal lobe, and this is the normal side, how it's nice, smooth, and flat, and you don't see any kind of impingement or anything that looks like it's jutting out. And so this is the normal side, and this is the side with the central and uncal herniation. I had a little game in here, so I didn't modify the slides completely. Okay, and this is just a little game. I'll add the slides onto eMedley if you want to play along and look and click on the different structures that you see that have protruded, which I just mentioned, where the uncus in the temporal lobe of the brain. And you can see how this side, is very damaged, and actually there was a hemorrhagic stroke up here, and so that pressure of the bleeding pushed the downward force, caused this uncal and central herniation of the brain. So you can see how it is usually not just one thing that you see, but you'll see a kind of a cause or a reason, unless the whole brain overall is just edematous. And you see how closely packed in these gyri are, and they're very flat because this brain was edematous, had a lot of edema. Okay, another kind of herniation is called a subfalcine herniation. So in this side, I've cut off the superior aspect of the cerebrum on this side, and the other side is intact. And what you see is the surface of the cerebrum here is normal, and all of this area normal, and this is the way it should be abutting the other side, and completely flat from the top all the way down. There shouldn't be any tissue jutting out from it. But you see that there is a tissue here that's jutting out, and it actually was being compressed by the false cerebri. So we also have that very tough dura that goes between the two cerebral hemispheres in this area, and that's why the brain tissue was compressed from the left side of this brain under the false cerebri, and it caused compression and damage to this part of the brain. So here you can see this is called a subfalcine herniation. And then I have a little game where you can click on the different problems that patient might have experienced. Now this last one is also pretty common, and it's called a tonsillar herniation. And so here you can see the back part of the occiput has been taken off, and you can see the brain. We were removing the brain in lab, and this is one of the cadavers that we were dissecting that had a really, really pronounced tonsillar herniation. So the tonsils of the cerebellum, which are parts of the cerebellum, actually protruded through the foramen magnum, which were at this level, protruded through and were covering up the posterior aspect of the brainstem itself. And so you can see the spinal cord down here, and this is the location of where the medulla oblongata, the most inferior aspect or caudal aspect of the brainstem. And these tonsils, as they protrude down, they actually compress the medulla oblongata. And so it causes symptoms in patients and ultimately death. And this is another view. Actually, I think I can click so you can see we removed the tonsils, this tissue that was compressing. Let's see if it works. No. Okay, there we go. So as I remove the tissue, you can see the medulla oblongata and the upper aspect of the spinal cord that was being compressed by the herniation. And this is another view. So this is a posterior view. So if you look at the brain up here, you can see the cerebellum. The tonsils are on the posterior side of this brainstem. So that's why they compress the brainstem. So this is a posterior view. And you can see, so if this was a level of the foramen magnum, that the tonsils came down inferior to the foramen magnum and put pressure on the medulla oblongata. And so this is another kind of herniation that you may see in lab, if not in your tank, in some of your classmates. Okay, that was it. I hope this is helpful, at least allow you to look for the presence of brain atrophy and edema, look for the presence of hemorrhagic or occlusive strokes, and then any herniation symptoms so that you can finalize your autopsy report. Thank you.